Thousands of women are diagnosed every year with cervical cancer, but it's also considered one of the most preventable cancers. And unlike others, a lot of cases can be caught very early. So we're going to talk about this today because it's Cervical Cancer Awareness Month. Joining me is gynecologic oncologist, Dr. Jeff James with HCA HealthONE. That's a tough, did I get it right?
You did.
Oncologist, which is, we're having some levity here and what is actually a really serious topic, of course. But let's talk just in general prevalence of cervical cancer. Is it rising? Is it just we're finding more cases now?
No, actually in the United States in particular, it's actually probably going down.
That's great.
Worldwide, however, it's still the fourth most common cancer that women are susceptible to, and primarily in underdeveloped countries where they don't have screening tools like we do here. That's where we see quite an abundance of it still yet.
Okay, talk to me about how we find it,
Yeah.
How we can find it earlier, and some prevention, which I feel like as a woman, I know we talk about this a lot with our doctors, but for those who maybe aren't super caught up on this. Yeah,
well, from like a chronologic standpoint, we're really pushing to vaccinate our young girls and even boys between the ages of 11 and 12, as young as 9. And the data shows that if we do it before the age of 17, there's significant benefit to decreasing the risk of precancer or cancer of the cervix in their lifetime.
Is that the HPV vaccines?
Yes.
It's like a series, right? A couple of them you get?
It is.
Okay.
And depending on your age and when you get them, the series can change in how many of the injections you get. But it is absolutely a series that most pediatricians or family practice providers do offer and provide. And it covers 9 of the most common strains of the human papillomavirus that do cause precancer and cancer of the cervix. And then certainly from a screening standpoint, starting at the age of 21, we suggest getting a pap smear. And depending on your age and your kind of personal history, the frequency of those pap smears and how we do them can change. But certainly doing those is going to be very important in terms of identifying a precancer before it develops into a cancer.
I feel like a couple of years ago, my memory is that for women who haven't had a history and have so far had good screens, doing them less frequently, which felt a little jarring. I never mind. I mean, it's not a fun screen to get. Let's be clear. But like, why space those out more? Are we worried at all that we might miss cancer, or does this develop slow enough that even if you're getting them every 3 to 5 years, it's not a big deal?
It's a great question. So really, between the ages of 21 and 29, it's every 3 years to get a pap smear as long as you don't have an elevated risk. The reason behind that, to your point, is that these are typically very slow-growing entities. So we're able to identify them in a precancerous state and take care of them before they develop into a cancer. Now, after the age of 29, between 30 and 65, it's a pap smear with HPV every 5 years as long as they're fine. And if they're not, then of course your provider who's doing the pap smear will make an appropriate recommendation of how to follow that up.
Okay. If someone, is there even a symptom, if you will, of cervical cancer? If someone is going to unfortunately be diagnosed, is there something you can look out for as a woman?
Absolutely. So probably one of the most significant symptoms is going to be postcoital or after intercourse bleeding that isn't normal. So, or discharge that is not normal, watery discharge, pain in the pelvic region that is abnormal for you. Any of those things really should be seen and followed up with a provider.
These are having these conversations on television, but like these are important. I mean, this is medical stuff, right? This is not meant to be like uncomfortable and like this is very serious. Women need to be looking out for this for their own health care.
100%.
You can't be like quietly having these conversations only in a doctor's office.
Absolutely, and I think the point of that, which I oftentimes have these conversations with patients in the room, is that the statistics show 80+% of women have HPV at some point in their life. And so
that often.
it's that prevalent. Now, they're not all the high-risk type.
Lead to cancer, okay.
Exactly. But just to talk about from a prevalent standpoint and having the conversations, you're 100% right. It's very, very common and prevalent. Probably at least a third of the patients that I see each day in clinic are HPV-related issues. And so we're hoping to see less and less of that as the vaccine starts really getting implemented in our young girls and boys to prevent it from happening in the future. But these are definitely things that we can prevent, or at least take care of very early before they develop into a cancer, or potentially even as a very early cancer, so that they don't become more problematic as they advance.
I feel like patients can really take a lot of ownership over their own body, their own health, know your systems, know what's normal, so that when something's not normal, you don't just like, what could that be? Like, go talk about it with your doctor.
Definitely.
All right. I really appreciate you today. Thank you so much, Dr. James. Ladies, keep an eye on your health.